Hi, Mr. Duffy. How are you doing today?
I'm doing great.
Good. My name is Jennifer, and I'm going to be your nurse. I'm going to be performing an abdominal assessment on you. Is that okay?
That's okay.
Okay. Have you emptied your bladder?
Yes.
And do you have any pain or tenderness that I need to know about?
No.
Okay. As you can see, Mr. Duffy has a small flat pillow under his head and a rolled pillow under his knees for comfort. He's fully dressed for purposes of the video, but normally he would be wearing a gown. It would be exposing his abdomen, and he'd be draped from the pelvic down for privacy. I'm going to start by performing observation of the abdomen. First, I'm looking at coloration. I'm looking for any bluish purplish tinges, yellow hues, paleness, shininess, which would be signs of taut, any redness or bruising. I don't see any of that. Next, I'm going to move on to vascularity. I'm looking for any dilated vessels, any dilated surface, arterioles. I'm looking for capillaries with spider angiomas. I don't see any of that. I'm also going to be looking for purplish bluish striae, which are known as stretch marks, deep or large or noticeable scarring. I'm looking for any non-healing wounds or signs of inflammation. I'm also looking for masses, lesions, bleeding moles, changes in moles or petechiae, and I don't see any of that. Looking at his umbilical area, I'm looking for, again, a bluish purplish tinge. I'm also looking for it to be deviated from the midline. That would be abnormal, or for it to be enlarged, and I don't see that. I'm looking at the contour of his abdomen. I'm looking for any protrusions, any sinking, any signs of distension, or any asymmetry, and I don't see anything. And so since he doesn't have signs of distension, I will not be measuring abdominal girth. I'm also observing his abdominal respirations, peristaltic waves, and pulsations. Abnormals with those are going to be any changes to his thoracic breathing, any decrease in abdominal breaths, any widening, accentuated pulsations, or any progressive ripple-like waves. And I don't see any of that. Mr. Duffy, go ahead and raise just your head up. And when he does this, I'm looking for bulges or protuberances. Go ahead and relax down. I didn't see any of that, so that's normal, looking good. Now, moving on to the auscultation part of the assessment. Using my stethoscope, the diaphragm, I'm going to listen to each quadrant for 1 to 5 minutes, but for purposes of the video, I'm going to move a little faster. Right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. With these abnormals that you would find are going to be absence, hyperactive, or hypoactive bell sounds, high-pitched, tinkling, or rushing noises, and I didn't hear any of that. Now with the bell of my stethoscope, I'm going to listen for the vascular sounds. I'm listening to the aorta, hepatic artery, iliac artery, and femoral artery. And abnormals with that are going to be bruits, which are low murmur-like sounds. And also using the bell of my stethoscope, I'm going to listen at the umbilicus and epigastric area for a venous hum, and an abnormal is an accentuated hum with that. Flipping my stethoscope over, I'm going to listen for a splenic and hepatic rub, and abnormals on that are going to be you shouldn't be able to hear any rub at all. Hepatic's right side, splenic is the left side, a little lower, and I didn't hear anything, so that's good, Mr. Duffy. Moving on to percussion, which is just a light tapping. I'm going to be listening for accentuated tympany, hyperresonance, enlarged areas of dullness, areas of unexpected dullness, or any hollow kind of sound all around the belly for ascites, and I didn't hear any of that. Now I'm going to percuss for the liver. Starting at the mid-clavicular line, I'm going to start here and percuss. For dullness, I'm going to mark where I hear it, and then I'm going to have him inhale and hold your breath and percuss for dullness. Again, I'm going to mark it, and you can relax now, and I'm going to measure that. Anything outside of 6 to 12 centimeters is going to be abnormal. And then we're going to go to the midline, and we're going to do the same thing. We're going to mark the dullness, and go ahead and inhale. And we're going to mark the dullness again. Measure it. The abnormal for that is going to be anything outside of 4 to 8 centimeters. Okay, and that was the liver. Now I'm going to percuss for the spleen. I'm going to mark dullness, and I'm percussing intercostally. Now go ahead and inhale and hold it. And I'm going to mark where the dullness starts again. Okay, relax. I'm going to measure it with a measuring tape. Anything larger than 7 centimeters is going to be abnormal on that. Now I'm going to have you sit up, Mr. Duffy, just for a second. And I'm going to perform blunt percussion on your kidneys. But lean forward a little so you don't. Yeah, there you go. Any pain?
No.
Okay, go ahead and relax back. Pain or tenderness is going to be an abnormal for that. Now I'm going to perform palpation, starting with light palpation in each quadrant. Any abnormals with this are going to be pain, tenderness, or rigidity or guarding. I didn't feel any of those. Did you have pain or tenderness?
No.
Okay, now deep palpation, sharp pain, or pretty severe tenderness, or unexpected masses are going to be abnormals. Did you have any of that?
No.
Okay, and I didn't feel any unexpected masses. Now I'm going to palpate the umbilicus, and an abnormal there is going to be a soft center or any nodules, and I don't feel any of that. Moving on, I'm going to palpate the aorta with my pointer finger and thumb, just to the left of the midline. Okay, there it is. It's just a slight pulsation. An abnormal would be an accentuated widening pulsation or a pulsating mass. And I don't feel that. Now to palpate the liver, I'm going to have you inhale and hook my fingers and pull up a little bit. There it is. Go ahead and relax. An abnormal there is going to be rigid, stiff, hard liver, or anything 1 to 3 centimeters below the costal margin, and I didn't feel that. Now with the spleen, I'm going to have you inhale again, Mr. Duffy. And I don't feel it, which is normal. Relax now. And abnormal there is to be able to palpate the spleen. And so now I'm going to try to palpate your kidney on your left side. Just a little below the costal margin. Go ahead and inhale slowly, and then exhale slowly, and hold your exhale as I release pressure. And that's called capturing the kidney, and I would perform it on this side then. Go ahead and inhale, and exhale, and hold it. Okay, and abnormals there are going to be asymmetries in the kidneys or enlargement of the kidneys. This concludes our assessment today, Mr. Duffy. Thank you.
Thank you so much.